This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wiseye.org.
live on YouTube. A reminder to maintain audio quality. Please remain muted until it's time to ask your question. If you are on the phone and are able to do so, please use *6 to mute and unmute. Also, we have a hard out at 2:15 today, so please only one question per reporter. Joining us for today's media briefing are Governor Tony Evers and DHS Secretary-designee Andrea. Also available to answer questions are Traci DeSalvo, Acting Director of the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks for joining us again today. I want to begin today with an important reminder for Wisconsinites about making sure you and your family have access to quality, affordable health care as we continue to fight this pandemic. Open enrollment for the Affordable Care Act ends Tuesday, December 15th. For most Wisconsinites, this is the deadline to sign up to get health care coverage for 2021. So don't wait. Head to healthcare.gov today to find a plan that works for you and your family. If this is your first time signing up or if you have questions, free expert advice is available by calling 211 or by visiting wiscovered.com. Having quality, affordable health care coverage is perhaps more important now than ever, so be sure and get covered. As Wisconsin continues to be a national hotspot for COVID-19 cases, our hospitals and healthcare workforce are being stretched to the limits. All across the state, we've heard stories of those in healthcare doing exceptional work under difficult circumstances. Working back-to-back shifts and head-to-toe PPE, going without seeing their families or loved ones so that they can keep working and stay healthy, and FaceTiming family and friends of patients so that they can have the precious moments of connection while isolated. And we've heard far too many tragic stories of nurses holding their patients' hands as they fought for their life, sometimes losing the battle to the virus without their loved ones there next to them. The weight on their shoulders is immense, and they are doing a remarkable job. But we have to remember that our healthcare heroes are not invincible. Every day they are putting their health and safety on the line to take care of our most vulnerable patients, sometimes having to quarantine at home because they have symptoms themselves or were exposed. In a state where we are already struggling to find healthcare workers before the pandemic, many hospitals and clinics are stretched thin. Yesterday, we announced approximately 45 U.S. Army medical personnel from the U.S. Department of Defense will be heading here to support Wisconsin folks at Marshfield Medical Center facilities in Marshfield, Eau Claire, Beaver Dam, and Rice Lake. The Marshfield Clinic System has been utilizing volunteers from the Wisconsin Emergency Assistance Volunteer Registry, but the need for more staff to meet patient demand remains a challenge, and this additional support will be crucial in helping meet patient needs. We're appreciative of this federal partnership at a time when our state and communities can really, really use it. It's also critically important that every Wisconsinite do their part to stop the spread of this virus by staying home and wearing masks whenever you have to go out. Your actions will not only help save lives, but will help protect our healthcare workforce by flattening the curve and reducing their risk for being exposed to the virus. With that, I will now hand things over to Secretary-designee Andrea for her update. Andrea, it's all yours.
Thanks, Governor. Good afternoon, everyone, and thanks for joining us. I do want to start today with an update on our case numbers. So here's where we stand. Today, we're reporting an additional 57,000 Wisconsinites have died from COVID-19, which brings our total deaths here in the state to 3,944, and reminds us, as it does every day, that we must do everything we can to prevent this virus from spreading further and causing more families to lose loved ones. We're adding 4,034 new cases today, which brings our total of confirmed cases here in Wisconsin to 426,099. Our 7-day average of daily confirmed cases is 3,770, and that is lower than it was a month ago. but our testing numbers are also down, and that is concerning. It's my hope that we're seeing fewer positive cases because fewer people are getting infected with COVID-19. But with our positivity rate as high as it is, we know we are not testing enough people to get an accurate picture of the virus here in Wisconsin. So if you've been exposed to COVID-19, get tested. If you have symptoms of COVID-19, get tested. And please quarantine while you wait for your results. If you test positive, be sure to notify your contacts and limit your contact with other people in your household to try to prevent transmitting the virus further. If you test negative, please keep staying home and monitor your symptoms. If you have a strong network of, we have a strong network of labs here in Wisconsin, and the capacity to process tests is almost 60,000 per day. Our lab capacity is only helpful if we use it, so please get a test if you need a test. Call your healthcare provider or visit one of our community testing sites. Testing is a key tool to box in the virus because it informs our decisions. If you know that you're infected and you do not interact with other people, you help prevent transmission, and that stops the spread. This month, we will likely add another tool to our toolbox to help stop the spread with the approval and then arrival of the COVID-19 vaccine here in Wisconsin. It's important to remember, though, that we all must continue to wear a mask, physically distance, wash our hands, and stay home as much as possible. Please don't go to a friend's house or invite a few people over for dinner. Even a small gathering can and does spread COVID-19. Until enough Wisconsinites have been vaccinated, these remain the best tools we have to stop the spread. And finally, before we take your questions today, I want to highlight that yesterday we launched our Wastewater Surveillance Dashboard, another tool in our statewide effort to understand the prevalence of the COVID-19 virus. Wastewater surveillance has been shown to detect increases in COVID-19 activity up to a week before testing. This project is a collaboration between DHS, the Wisconsin State Lab of Hygiene, and the University of Wisconsin-Milwaukee. And this dashboard is part of our continued commitment to data transparency. Thank you for doing your part to stop the spread.
And thank you. We'll now take your questions. A reminder to maintain audio quality, to please keep phones on mute until it's time to ask your question. And again, a reminder that we have a hard out at 2:15, so please only one question per reporter. And we'll begin this afternoon with Danny Maxwell from WKOW in Madison. Danny? Danny Maxwell? Okay, moving on then to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. I was just wondering, a question for the governor, if there's been any sort of an update or if you've heard anything since you requested that the state receive priority when it comes to the vaccine. Thank you.
Yeah, great question. And I was hoping to, but frankly, I have not. They're busy doing all sorts of things in Washington, D.C., and in addition to concerning themselves about the virus. So to answer your question, no, I have not heard. We're hopeful that we will hear soon.
Thank you, Mitchell. Now to Eric Gunn from Wisconsin Examiner. Eric?
I think this is for the folks from DHS. The numbers of deaths are honestly going up at a pretty rapid clip, and yet the positive case numbers overall are lower, as you pointed out. I think there are a lot of probably hypothetical explanations for that seeming divergence in the data, but I'm wondering what you think may contribute to those different sorts of increases you're seeing there, if that makes sense.
Yep.
Thank you.
Yep. Thanks, Eric. So I would welcome Traci weighing in on this as well. But right, one of the things we know about this virus is, the 14-day incubation period. Many folks are asymptomatic, but those who do get symptoms do require hospitalization or illness severe enough to cause death. Right, that's what we talk about as a lagging indicator, and so. the deaths that we are seeing now, that continued high level on a daily basis, is the result of infections that happened previously. And so I think what we would hope over time is that if we continue to see our case numbers decline, that lagging indicator of deaths will start to come down because of the lower number of cases that we're seeing. Again, assuming that it's not completely connected to the lower number of tests that we're seeing on a daily basis. But when we were seeing those really, really high numbers of cases, those record numbers in mid-November leading up to the Thanksgiving holiday, a lot of those new daily cases are now what you are seeing in our death numbers. But Traci, if you have more you'd like to say, I would certainly welcome it.
I think that's exactly right, Secretary Palm.
Thank you, Eric. Now to Katie Anderson from WBAY-TV in Green Bay. Katie. Katie Anderson? Okay, we'll move on then to Winnie Dortch from CBS 58 in Milwaukee. Winnie? Again, Winnie Dortch from CBS 58. Okay, moving on then to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi. Hi. Thanks for taking our questions. Mine's kind of directed more towards the Department of Health Services. When can we really expect to see a Thanksgiving spike? We haven't seen, I guess, what people would call a significant spike yet after Thanksgiving. And if something like that doesn't occur, why wouldn't that happen? Why wouldn't there be any kind of spike? And is there any kind of explanation as to why that could be? Thanks.
Yeah. I mean, it's certainly, the timing is certainly right to ask the question, considering today is day 14, right, post Thanksgiving. And so if you're assuming those gatherings happened on Thanksgiving Day, I do think we are a little bit concerned that the decrease in the testing that we have seen coming out of the Thanksgiving holiday may be falsely undercounting our number of new daily cases, and so we hope that does not that we don't understand our Thanksgiving spike in the form of increased hospitalizations in the future. But I think we certainly could and would expect to see increases in daily cases coming out of now that we've hit that 14-day incubation period. But Traci, I'd welcome you to dig into that a little more.
Thanks, Secretary Palm. And I think you're exactly right. We think that part of what's contributing to not seeing an additional spike is that we maybe are not having as many people getting tested as we'd like to see. So we really do want to encourage people, if you have symptoms of COVID-19, if you have a known exposure to someone who is a confirmed case of COVID-19, we really want to encourage you to get out there, talk to your provider, go to a community testing site and get tested.
Thank you, Casey. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, my question was literally just asked, but I guess just to kind of go over that question one more time. So you're saying that Wisconsinites, from your knowledge, did not necessarily heed officials' warnings back in, the days leading up to Thanksgiving to not gather and to not travel for the holiday weekend?
Yeah, I think what we understand certainly nationally is that lots of people did travel for Thanksgiving. I certainly know that Wisconsinites do take COVID-19 seriously, that we are all working to do everything we can, but I think there also is some false sense of safety within our bubbles. Everyone thinks their bubble is safe, that the folks they know, the folks they are closest to are all being safe, but the kind of prevalence, the kind of intense community spread we have been seeing here in Wisconsin suggests, and what we know in the data, that as much as 50% of transmission is asymptomatic. People who are not experiencing symptoms, and so people have COVID and can transmit it without knowing that they have the virus. And so the fact that we all think we are being safe is good, but it means we probably need to be more safe. We need to do more things to be safer because we're still seeing considerable transmission here in the state of Wisconsin. And it's not like people are doing it on purpose. I think this asymptomatic thing, if you can't see it, it must not be happening, gives us all a false sense of the disease. And so we just need to continue to practice the things we know that work, staying home as much as possible, wearing a mask, keeping your errands to the essentials like groceries and the pharmacy, and really double down here over the next number of months as we start to get vaccines in arms.
Thank you, Madeline. Now to Mason Dowling from WAOW TV in Wausau. Mason?
Hi, thanks for taking this call. Just a quick question, and I imagine this would be either for DHS or whoever wants to answer it. But do we have any idea more so of what priority would look like when a vaccine is implemented in the state, as far as who might get it first, whether it's, obviously I know healthcare workers are kind of top of the list, but then from there on, where do we go? Is it nursing homes? Is it hospitals? Where would it be?
Yeah, I appreciate the question. We have received recommendations from the Federal Advisory Committee on Immunization Practices that have been taken up by, here in the state of Wisconsin, our State Disaster Medical Advisory Committee. And those very top priority folks are, as you mentioned, healthcare workers and those who work and reside in long-term care, in skilled nursing facilities, particularly nursing homes. And so our committee today met this morning, the SDMAC, the State Disaster Medical Advisory Committee, to look at how they might provide some additional guidance here in the state of Wisconsin, because obviously the number of those folks is, well exceeds our first allocation of vaccines, and will continue to as vaccine ramps up until we can catch up with that 400,000 plus number of healthcare workers, for example. And so they met this morning to look at, within healthcare workers, how can entities that are going to be providing vaccination, how do they think about which healthcare workers first? Somebody in an ICU, somebody who's working on a COVID unit, et cetera, those kinds of considerations, so that folks who are going to be vaccinating healthcare workers can prioritize further within that tier, as again, it's a scarce resource that is not going to meet the need for all healthcare workers right out of the gate. So how do we think about cascading within that tier? And so that work is happening at the state level. I anticipate their recommendations will be forthcoming, and we'll be able to turn that guidance around to vaccinators across the state, and then it'll go from there.
Thank you, Mason. Now to Stephanie Hoff from West Politics. Stephanie.
Good afternoon, and thanks for taking my call. So it looks like for the first time in months, one county has fallen into the high category, and even though it's the high category, that's the lowest we've seen in a few months. So just looking for some context on that. Does that mean we're flattening the curve? Is it only because of the low case counts from low testing? Just looking for context. Thank you.
Traci, would you be willing to take that?
Sure, Secretary Holmes, thanks. I think we're glad to see, this is sort of one of the indicators that there's somewhat of a downward trend. And I'm glad to see that we have counties moving sort of from that critically high down through the very high level and down to high. I think we want to keep in mind that transmission is still very high. We still do have really high case numbers in the state. but it is a good indicator that perhaps we might be headed in the right direction as we start to see, especially individual counties moving down. But do want to just emphasize that still is a high level, and we want people to continue to practice their precautions, even in areas where we're seeing a decreasing trajectory, wearing those masks, staying home whenever possible, and maintaining your physical distancing.
Thank you, Stephanie. Now to Todd Richmond from the Associated Press. Todd?
Hi there. Yesterday, Voss and Lemmerhue had said that they want to take oversight of any additional federal funding that comes for pandemic relief. They also want oversight of the vaccine distribution. Wondering what the governor thinks about those remarks.
Well, they're actually things we've talked about with them, and we understand. Let's put it this way. I heard their request. It's something we're continuing to discuss. Clearly, if you think about over 100 people in the Capitol figuring out who gets the vaccine first or second and so on, I mean, that doesn't even pass the smell test. And so we're concerned about that. We're also concerned about oversight. I mean, at this point in time, we're in a pandemic. We need to make decisions on a timely basis. And so we'll continue to talk with them about, we have talked about this already, and we'll continue to talk about that in the future. I think we're trying to arrange a meeting sometime next week, early next week, to further discuss it, and other items too.
Thank you, Todd. Now to Ben Krumholtz from WLUK in Green Bay. Ben?
Hi, thank you for the opportunity today. Governor, what points were made in the reply that was due today to the Texas lawsuit?
My comments about the Texas lawsuit, I made some a couple days ago, and I'll kind of repeat them. It's ironic to me that the Texas Attorney General, who is under FBI investigation, as well as having numerous calls for his resignation by folks all across Texas, is leading the charge, and now we have another 17 or so Republican AGs getting behind it. It's a frivolous suit. It won't go anyplace. The idea that somehow the state of Texas is going to take away the vote of millions and millions of people in the state of Wisconsin, it just borders on insanity. So I guess that's my view of the world.
Thank you, Ben. Now to Denise Lockwood from Racine County Eye. Denise?
Thanks. I wanted to understand the relationship between the testing of wastewater and what it tells you about how much COVID virus is out there, and some of the initiatives that you guys have started off with that. Where are things at with that?
Yeah, we did start that partnership earlier this summer and did announce some initial findings yesterday. Traci, it sounded like you were going to jump in there, so I will let you do that.
Sure. Thanks, Secretary Palm. The wastewater study is a great tool. What we're able to do is measure in wastewater effluent the number of gene copies per person per day. And it's really a useful tool for public health, both as an early indicator, perhaps when you're sort of at lower case levels and you're looking to determine when there might be an increase in a community. But it can also be an indicator of maybe when testing coverage is not adequate in an area. We can look and see, are we seeing an increase that the testing isn't reflecting? So that's one of the reasons, as you look at that dashboard, you can see sort of the concentration, and then below it, you also see us showing the case rate per 100,000. And so we hope that this is a tool both to sort of serve as an early indicator and help us to see maybe some things that we're not able to see as testing rates aren't as high as we'd like them to be.
Thank you, Denise. Now to Sophie Carson from USA Today Network, Wisconsin. Sophie.
Hi, my question is, if at all, how much has the increased rapid testing at the UW systems sites played a role in the decline in cases we've seen, since those aren't counted in the overall numbers?
Well, all of our antigen tests are counted as probable cases, and if they receive PCR confirmation, then they are moved from probable into a dispositive, either positive or negative. So we do use that data certainly to inform the prevalence and our understanding of the disease here in Wisconsin. I think one of the drawbacks and the reason why they're kept as probable is because they have lower sensitivity, and we recently through our partnership with UW and the testing that they have done using antigen tests, have put a number on that sensitivity of about 41%, and so it is why we continue to want PCR confirmation of those tests, because their accuracy is so much lower, and we want to make sure that what we are reporting, that what we are recording is accurate and does reflect positive cases here in the state of Wisconsin. But again, they're an important tool. They are particularly more helpful with symptomatic people, and so we will continue to deploy them in settings where they provide us with the best information, with helpful information, as we continue to track and work to slow the spread here in Wisconsin.
Thank you, Sophie. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this today. In addition to the U.S. Army deployment, I know that Marshfield Clinic has also seen 2 medical teams from HHS. I was just wondering, are there any other federal workers that have been deployed to the state to help with the COVID-19 surge, and are there any plans to bring in additional ones? Thank you.
Yeah. Sean, the answer is yes, there have been other federal teams that have come. I'm going to want to let somebody get you the specifics, because off the top of my head, I just don't want to get it wrong. I think when we're thinking about our staffing shortages, which is absolutely a focus for us in partnership both with our hospitals as well as our skilled nursing facilities, we take a number of steps in addition to the licensure flexibilities and some of the other things that we've talked about over time. We want to make sure we are exhausting any resources that are in our Weaver database. We have brought on contract staffing firm, actually 2 staffing firms now, and are fulfilling staffing requests through that project, through that process. And then we also, should we not be able to accomplish that goal through these staffing contracts, we do take those requests to the federal government, and they are fulfilled from a variety of places, as you suggest, HHS, DOD, FEMA. So we are trying to have as many tools in our toolbox to make sure that we are doing everything we can to ensure that we've got staff to take care of folks who need hospitalization or who live in skilled nursing facilities. But I would be remiss if I did not say what I always say, which is this is a reminder that we all need to continue to do everything we can to stop the spread of this disease, so that we reduce the strain on our hospital systems, we reduce their exposure, the frontline healthcare worker exposure in the community to COVID, and we reduce the number of people who need hospitalization. The outcome of this, the day-to-day of this is in our hands, and we just need to continue to do everything we can to stop the spread while we wait to be able to get enough vaccines in the arms of Wisconsinites to end this pandemic here.
Thank you, Sean. Now to Katie Crowther from TMJ4 in Milwaukee. Katie.
Hi, thanks for taking this call. I just have a question. Once a vaccine is federally approved, what are the regulatory steps here in Wisconsin? Who signs off on it? What are those steps in getting it out to the people here after that approval?
Yeah. Appreciate the question. So we anticipate, right, rolling approval, likely Pfizer first, should all the I's and T's get dotted and crossed, then Moderna. After that happens with the FDA, it moves to the Federal Advisory Committee on Immunization Practices, where they will take a look at the approval and provide some clinical guidance, side effects, dosing regimens, things that clinicians, that actual vaccinators need to understand to safely dispense that vaccine, and then the CDC will push that information out to the states, as well as necessary information and guidance on consent forms and other types of the materials that we need to execute a vaccine program here in Wisconsin and in across the country, for all states as well. And then obviously we will push that information through the system out to providers who will need to take that knowledge, the guidance, the clinical guidance and training necessary to safely put vaccines in arms, and then vaccine will roll. So there is not a regulatory issue here in the state. The FDA approval is the regulatory trigger, but there are safety and clinical guidance and requirements that need to be part of the rollout of the vaccine, and we will certainly be doing that here to make sure that vaccine is safely administered all across the state.
Thank you, Katie. Now to Chuck Kornbach from Milwaukee Public Radio. Chuck?
Afternoon, hoping you can hear me. Governor, also on the WMC call yesterday with Speaker Voss and Senator Lemahue, was the issue of business ability. They seem pretty united, Republicans, WMC, protecting business.
Chuck, you have...
Yeah, I think that was about business liability protections that the Speaker Majority Leader were calling for.
Yeah, and you want to try to give that a shot?
Yeah, I mean, I think this is something that, Chuck, this is Ryan Nilsestuen, this is something they've called for repeatedly, warning of a tsunami of litigation related to COVID-19, something they said back in February, something they said in March. While we're in December, we've yet to see this tsunami of litigation. And so I think it's really problematic when you want to provide protections against litigation, but you don't want to do anything in terms of mitigating the virus or protecting people, and that's problematic.
Thank you, Chuck. Now to Maddie Heim from the Appleton Post-Crescent. Maddie?
Hi, thanks for having this call. So some states are concerned about this data use agreement that the CDC is asking them to sign to provide personal data from people who get the COVID vaccine. And I'm just wondering, has Wisconsin signed that? And does it worry you that it could make people hesitant to get the vaccine if they know that their personal information might be shared with the federal government? Thanks.
Maddie, I am not familiar with this data use agreement. I don't know. Traci, do you know anything about that, or should we get back to Maddie?
I think we should get back to Maddie on this one.
Okay, and we will do that. Thank you. Now to Adam Rogan from the Journal-Times in Racine. Adam?
My question has been asked. Thank you very much.
Thank you. Now to Asel Razai from Spectrum News. Asel? Spectrum?
Yeah, this question could be for DHS or the governor. I'm just wondering, as we are still seeing a very high strain on our hospitals, if just going into the upcoming holidays, there might be a recommendation or consideration of a possible shutdown like we've seen in some other major cities across the country.
Well, I'll answer it from my level. That is a concern that holidays will cause more cases and more, frankly, the lagging indicator, the main one, and that's being death. And so we're hoping that people will wear their masks. There's still an order out on that, and do the right things. If you're asking, are we going to move forward with a shutdown or a lockdown, the Republicans have essentially taken those tools away from us. So it's unlikely that we will go down that road. We hope that the people of Wisconsin will do the right thing and keep their families, their friends, and their neighbors and the people that work in the system safe and healthy by staying home.
Thank you, Sal. Now to Nick Bohr from WISN TV in Milwaukee. Nick.
Good afternoon. Governor, a number of school districts are making decisions this week about what school will look like after the winter break. Given the latest data on spread in schools and educational outcomes, what would you like school districts to do? Well,
I've been pretty much hands off on this issue all the way along, because I think, actually, even though it's been messy, school district boards and others that are decision makers in the districts have been making decisions right along with the public health officials in their local counties and municipalities. And I think that's something that's important to recognize, that has worked for some school districts, and some school districts there has been some trauma around that. But clearly, every educator, and I'll put myself in that case, is concerned about outcomes for kids, and the present system is anything but divine in that respect. So I would say the good news here is that there have been some good, wise decisions being made about closing when need or going virtual when they need to, staying open when they can. There is a fair amount of data out there now that indicate that younger children are less of a transmitter of this disease, and we're seeing some success across the country, frankly, with opening up schools for younger children. I see from just looking at the politics of this issue, and there is, that the leader of the American Federation of Teachers has worked with New York City as it relates to reopening their schools for young children, and making sure that the teachers that are in those buildings have the opportunity to have the proper PPE and the ventilation's good and all that sort of thing. So there seems to be some meeting of the minds around that. And in addition, we have a vaccine coming. Obviously, teachers are not the first in the order of those being vaccinated, but I know the president has indicated an interest in having them be earlier than, say, me, and I'm okay with that.
Thank you, Nick. Now to Brian Rebke from the Kaukauna Times-Villager. Brian?
Yes, this question actually is kind of a segue to the last one. It seems like parent infections are causing a lot of students to be out of school and quarantine. Is there thought of having parents of school-aged children high on the priority list to get their kids in school?
Well, I'll just, again, answer that from my vantage point. The healthcare folks may have a different answer. There's just so many people we can prioritize, and it's similar to the healthcare in facilities right now. It's important to vaccinate the healthcare workers. I think one could make an argument that if a spouse of a healthcare worker finds themselves in a position to have the disease, that somehow we need to suddenly inoculate them too and vaccinate them. There's a limit, and so I'm guessing that my colleagues here from the healthcare world would suggest that there are essential workers and there are people that are family members of essential workers. The latter will not be somebody that is getting that vaccination with their spouse.
Thank you, Brian. I'm sorry.
I would just say that we, as the Federal Advisory Committee takes up additional tiers or populations to prioritize, we will be very interested in their recommendations. I think a lot of these recommendations need to be based on what comes out of the FDA as it relates to populations and subpopulations and issues like side effects and others. And so I think they have been smart not to prioritize before they have all the information in front of them, but we will await their recommendations, and then our advisory committee will further refine them for us here in Wisconsin.
Thank you, Brian. And our final question today belongs to Ben Boken from NBC 26 in Green Bay. Ben? NBC 26? Okay, since we have a few minutes, we'll go back to those we may have missed earlier. Danny Maxwell from WKOW.
Hello?
Oh, I'm sorry. Is this
Hello,
Ben?
can you hear me?
Yes, we can. Go ahead, please.
Hi, this is AJ with WKOW. I jumped in a little bit after Danny Maxwell's turn. Can I get one in real quick here?
Go ahead, please.
All right, thank you. This is for Governor Evers. In light of the Assembly Committee on Elections having its hearing tomorrow, some of the comments that Senator Johnson has made earlier this week citing irregularities and a hearing that he is planning on having in Washington next week, how concerned are you that regardless of any legal outcomes, there's a precedent set for people not having full trust in election outcomes? And if that is a concern for you, what do you believe that you can do to provide a platform to the election staff across the state who insist that this was a clean election?
Yeah, and that is you hit the nail on the head. Joe Biden will be the next president of the United States. People understand that, but right from the get-go, our president has said that if he loses, it's because it's rigged, and he has been talking about that nonstop for the last 3 months or 4 months, and I think he has done immense damage to the elections system of the United States of America, including ours here in Wisconsin. If you think about it, we have thousands of people all across the state that work their tails off to make sure that the voting is safe, fair, follow the law. There's volunteers, there are clerks in local municipalities. There's people doing the right thing, keeping people safe during a pandemic. And to have this election turn out to be such a disaster as it relates to people's belief in the system of voting, and really I'm concerned about that. And I think the hearing that's going to be tomorrow, it's going to be the same old crap, frankly. It's going to be people coming in without direct knowledge, giving some kind of harebrained charge that can't be validated. And we're going to continue to do this. And every time we do it, every time we do something like this as a country, as a state, as individuals, we're taking more people out of the system. They're going to say, this is crazy, I'm not going to vote anymore. So yeah, there's a hell of a lot of damage going on. We will continue to fight this trend, but the president has set us down a path that is a very dangerous path, and I'm very, very concerned about that.
Thank you, WKOW. And that concludes today's briefing. If we didn't hear your question, please feel free to contact the
This
DHS
program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.